can't thank you enough for even saying the words, empowering the patient, what they can go back and say to the doctor can be very intimidating. When you're sick, you know, sometimes your relationships can become more paternalistic or maternalistic with your your physician. You retreat, you become childlike, and this is the time where you've just helped so many women and their loved ones stand up, know how to find their voice, and thank you for helping to get the words so patients have an easier time.
Well, I think I just want to finish up with this concept, because I'm always, we come to these big meetings, we see these huge studies, and you know, a patient shouldn't feel like she's reduced down to a study. She's a unique individual, and I always tell patients that if it ever, my own patients, if you ever feel like I'm not here to work for you, then we need to address it up front. And you know, if patients ever feel like their own physician isn't their advocate, this idea of paternalism, I feel very strongly about this, then you know, patients do need to be empowered, and this data would empower them to have a discussion about, hey, I have a HER2 positive breast cancer. I want to be given this advantage of combining the two agents, even if it does not have regulatory approval.
And your work has really given a gift to women to help reinterpret their situation.
Yeah. Well, and the women that were enrolled in this study, you know, these are women that really had gone through all of the approved combinations. Their tumors had progressed, the drugs had failed the women, to be quite honest, and it really was...
Thank you for that distinction.
Yeah, it drives me nuts.
Yes, the patient didn't fail.
Yeah, that's a very unfortunate statement. And so I really feel like, you know, these women are faced with a cancer that we now have a good combination that has less side effects. This is not just combining drugs so people live longer. This is combining drugs so not only do they live longer, but they're not sick from the treatment.
It's a quality of life.
Yeah, and I think that's a real, I think for me, the biology is important behind this study. That if you can get the right drugs to the right patients whose tumors will respond, then we really can make an impact, irregardless of how long a woman's faced metastatic breast cancer. And although my study did not have an arm that involved traditional chemotherapy, I think it's really strong evidence that we need to be a little let go of some of the older treatments. And patients are brave enough. I mean, I said the word brave, I think, twice in my presentation today. Brave enough to say goodbye to the chemotherapy. We're spending billions of dollars in drug development, and not to get too political, but these drugs that are in trial, I'd encourage patients to participate because we know how they work. And our biggest problem right now is not having good drugs. It's really getting information out about clinical trials.
Well, and I was, as you were speaking, I was thinking about that because I think that your work is really representative if women are leery.
Yeah.
I don't care if any cancer patients say, I don't know about clinical trials. Dr. Kimberly Blackwell's work is symbolic and representative of all the benefits of a clinical trial.
Yeah, it takes too long to get new drugs approved. So I really feel as though if a patient needs to understand what her tumor is, what category her tumor falls in, and her physician needs to guide her to what new drugs are available. And in the case of HER2 positive breast cancer, this is the tip of the iceberg for getting out the old chemotherapy and really targeting the HER2 not only very precisely so there's not side effects, but very effectively.
Thank you.
Sure.
And I can tell you're emitting not only passion, but real excitement, and it shows in your face.
I hope we can throw away the chemotherapy before I retire. So, I mean, that really is my goal, which is one day a patient comes in, I take a piece of their tumor, I put it in some fancy, I'm sure, billion-dollar machine, and out pops the pill that will cure them of their metastatic breast cancer. I really hope I live to see that day.
I hope so too.
Yeah.
I hope that I'm going into what, my 29th year or something of breast cancer survival here, that I've lived this long to see the transformation.
Sure.
And I am HER2 positive, and of course when I was diagnosed, who would have known that?
Yeah.
So that I have lived this long, you've instilled, I have renewed hope.
Yeah, and better treatments are there too, so good luck to you and all the people that are faced, all the women that are faced with, people, are faced with breast cancer.
And I'm sure you're going to be off to a new study, and you're going to be, who knows what.
Oh yeah, there's some good stuff out there. I'm really excited about the vaccines. We understand more about the immune system than we ever have. And I think for long-term breast cancer survivors like yourself and many of the patients I take care of, the reality is your body's fighting that cancer as hard as these drugs. So you need to really, it's a hard discussion because we don't want to, we've heard a lot at this meeting, that we don't want to, for physicians, you know, we don't want to say, you know what, you need to lose weight. I think it will impact you. I think you need to exercise and lower your stress levels, because your body really is actually smarter than the cancer. You just need to be kind to it.
So same time next year?
Sure. I hopefully have something even better next year.
Dr. Kimberly Blackwell, Associate Professor of Medicine, Duke Comprehensive Medical Center, Durham, North Carolina. Thank you.
Sure, thank you.
So much.